Has some of the longest emergency room wait times in the country, and Prince George's County exceeds state averages. As WAMU's Jenny Abamu reports, despite opening a new hospital in 2021, wait times in Prince George's have not improved.
It's 11 in the morning at the University of Maryland Capital Region Medical Center in Largo. Kimberly McNaughton brought her 15-year-old son to get stitches for a cut finger the night before. They gave up after 3 hours, returning at 6 a.m. They were still waiting 5 hours later.
You would think they built this new facility under the pretense that we would be provided quicker services, considering that this is the primary emergency room hospital in this demographic.
The long-awaited Largo Hospital opened with $400 million in state and local funds. County officials hoped it would attract top medical talent and improve care for residents. But 3 years in, the hospital's reputation is faltering as complaints about service and emergency room times mount. County officials created a task force led by Councilmember Walla Bligay to address the issues.
The quality of life is being able to have quality health care near your home. So what we're trying to do is now tell our own story so people can understand we've got a healthcare crisis.
The task force found a lack of local primary care doctors means patients have to go to the emergency room because of lack of routine care. The county also faces a shortage of ER nurses. Another question is whether there's enough hospital beds. Too few beds creates bottlenecks in the ER. The 5 hospitals in Prince George's County have fewer than half the number of beds of neighboring Montgomery County, despite having close to the same population. A 2023 county audit to identify gaps between Prince George's County and surrounding communities found that the county indeed had too few beds. At the time, state officials decided that the excess beds in Montgomery County and D.C. would make up for any deficit in Prince George's. So the Largo Hospital got 205 beds, fewer than the hospital it replaced. State Delegate Ashanti Martinez spoke to the ER task force in July, taking issue with the idea that Prince George's residents should be expected to travel for hospital care.
They look at it from a statewide lens. And so they look at, okay, you live, let's say in Laurel, you're close enough to go to care in Montgomery, or, the drive to Baltimore is not that far for them.
In the meantime, the state launched its own task force on statewide ER wait times. State officials also recently changed their evaluation process to consider health equity, meaning disparities in availability and quality of care in different regions. The task force expects to have recommendations later this year. Some hospitals are coming up with their own solutions. Adventist Healthcare Fort Washington Medical Center has some of the shortest wait times in Prince George's County. The hospital